Hi, I'll be talking about HIV/AIDS, the test and treat strategy. This is a newly developed strategy that came into limelight in 2009. That's HIV/AIDS, HIV test and treat. This is a strategy that will help reduce the viral load of HIV in our communities and help increase life expectancy. First on my program, I have the introduction of what is HIV, what causes HIV, how it is spread in the community, how it requires medical diagnosis, test, and imaging. Then it goes to what is test and treat strategy. It's like you don't have to be sick before having a test on HIV. You just have to up, have a test of HIV. If you're positive, if you're negative, that's good, fine. If you're positive, well, good, you discovered early enough so you could start a treatment, a regimen with the ART, that's the antiretroviral treatment, which will help provide drugs. Because, first of all, HIV has no cure as of the moment, so you can only treat, reduce the viral load, so it could sustain and keep you moving for the time being. Then you have causes of the prevalence in the District of Columbia, because this study is based on Washington, D.C., the District of Columbia. So we have all of it's common in society, but for this, we know HIV is transmitted through having multiple sexual partners, men having sex with men, the MSM, like gay, illicit drug use, people exchange syringes using it for drugs, and it's contaminated from one patient to the other. Contact with infected body, yes. So lack of using preservatives. Some people don't even mind using like condoms for to preserve any disease. And also, using this antiretroviral treatment is better, especially for pregnant women who will be on a regimen. So even if, because it doesn't matter if you have HIV, you're barred from having children. No. So if you have HIV, you can follow treatment and be on a regimen that you could still have babies, but the disease will not be transmitted to the baby. So that's why it's good to test and treat before going into such venture, because if you don't test and treat, then you infect your baby, and that becomes two people already infected, and that's how it will spread very wide in the community. Then you have the impact it has on the community of the Washington D.C. area. It reduces the labor force. Some people drop out of the workforce because of energy wise. They sick, they cannot meet up. It brings financial hardship to families, burden. It weakens the immune system, damages the C4 count cells, which is the white blood cells that protects our system, which is the immune system. So if it's weakened, you are prone to many diseases, vulnerable to many diseases. People who have HIV are prone to diseases like tuberculosis, which is so easy for them to catch. And another thing with HIV is the stigma, the discrimination. People are stigmatized because of having a disease. So that's how people don't even want to test. They don't want to be attached to. So this program will help people to reinforce their stance and educate them on the essence of test, and you treat yourself before it gets so bad, the level of death, because HIV is a chronic disease. This study will be like a 3-year study research program in the District of Columbia. Then, yeah, like I did a research question and a hypothesis for this. The research question is, how effective is the HIV test and treat strategy for a vulnerable population of Washington, D.C. area community? Then let me take it all over again. Research question: how effective is the HIV test and treat strategy for a vulnerable population of Washington, D.C. area community? And the hypothesis of this research: the HIV test and treat strategy will increase life expectancy. We'll move over to I did the the variables and the instruments used to treat. So the independent variable is the HIV screening test and treat, and the dependent variable the District of Columbia residents and patients. Instruments used the CD for antiretroviral therapy, dependent variable the CEPAC model, the screening model, and the disease model. This program would do a lot of enrollment and test strategy for the disease. So we have to recruit women, men, whites, Hispanics, blacks, boys and girls, which will bring all the community together from different backgrounds, so that you could have a clear understanding of how the disease is spreading. And we use we have like the benefits of the blood testing, which increases life expectancy, increased screening, testing frequency, reduction in overall population in transmission, and benefits to test and treat improve. Then and yeah, so in essence, that's what is needed in this research study. Educate the public, the community, on the essence of test and treat, and eventually we'll have a reduced infection in our community. Thank you.